Good morning. Let's get the show on the road. Very nice to see you. Welcome back.
The Nuffield Trust Summit has become a permanent fixture in the health policy calendar. And in March 2013, around 150 health leaders gathered for the two-day conference, on the eve of the implementation of the government's NHS reforms. Our fifth summit concentrated on the linked issues of quality and finance. The clear message was that the health service will have to improve the former while having less of the latter.
I mean, for us, the key issue is the relationship between pay and productivity. So we don't just look at pay, we look at that relationship. And the more productivity you achieve, the more you can afford to raise pay. So I would look at both sides, because they're both variables you can manipulate.
Many speakers and delegates agreed that some elements of the current model of NHS care need reform. Robert Francis QC, fresh from his report into care failings at Mid Staffordshire, outlined his vision.
First and foremost seems to be openness, transparency and candour. You don't actually need rules and regulations to get you to do that. We can start to be completely honest and open with patients who've been harmed today. We can set about with the professions producing information which gives us a balanced picture of the poor things that are going on as well as the good things. We can ban gagging clauses in trusts so that people aren't prevented from raising patient concerns. Everything that I have said should be encouraged by regulation, or everything that I've said that requires accountability can be done without those things. What I've said, however, seems to be unhappily the conclusion that we need some regulation, and we need some encouragement in relation to criminal sanctions, because otherwise these things won't work.
The summit featured a combination of keynote speeches, plenaries and breakout sessions to encourage networking among delegates. It examined key issues such as innovations in commissioning, new models of primary care, payment reform, the power of data and transparency, and public confidence in the NHS. Delegates were treated to the summit's regular topical debates, with prominent parliamentarians and commentators such as Stephen Dorrell, Polly Toynbee, Roy Lilly, Jeremy Taylor and Branwen Jeffries debating the future of the NHS.
So Jeremy, is the answer to this to have, whoever is on the board, a much stronger patient voice? And are we going to get anything like that in the next few years? You know, there's been a succession of organisations that are meant to facilitate patients' experience coming through the system, and they haven't succeeded.
I think we need to tackle this at all levels. So I think there should be patient leaders on boards. The Foundation Trust Governor model doesn't seem to quite work, but in principle, it is a way of bringing lay people who need training and help and support to play, and Robert Francis said this.
Lay, are they?
A global perspective was provided by a number of leading figures from international health systems. Several of the sessions were live-streamed to a virtual audience in the UK and internationally. Conversations and comments on social media went on throughout the summit, helped by our media partners, the BMJ and the Guardian Healthcare Network. The summit ended with one of Jeremy Hunt's first major speeches on health as the new Secretary of State. In it, he criticised mediocrity in the NHS and called for more ambition to ensure all providers performed at the level of the best in the service.
If the sum of our ambitions is not to come last, if all our attention is on the avoidance of failure, how much more likely are we to then fail than if our aspirations are to be the best in the world? Nye Bevan said that the worst kind of poverty was the poverty of low aspirations. We must never let that be said about our NHS.
We're grateful to all the speakers and delegates who made the summit such an engaging event. We're also grateful to our media partners, the BMJ and the Guardian Healthcare Network, to our research partner Ipsos Mori, and to our supporters McKinsey, PwC, Serco and Boston Consulting Group. We look forward to our next summit, which is being held on the 6th and 7th of March 2014.